Right, Pharmac. Well, it's going to fund multiple cancer drugs for Kiwis battling breast or blood cancers. This is new funding new drugs. It's part of the first round of $191 million of spending by the drug buying agency. Also included treatments for multiple sclerosis, wider access to safe sex drug PrEP, and COVID drugs for the immune compromised. Patient advocate and chair of Patient Voice Aotearoa, Malcolm Mulholland, is with us this morning. Right after we speak to Malcolm, we're going to speak to Pharmac themselves. Malcolm, good morning, Morena.
Morena.
Tell me, what's your reaction to this?
My reaction is I think Pharmac are trying to redefine the word new. They came out yesterday with a press release and said, good job, look at us, give ourselves a pat on the back, when many of the drugs that they're referring to have been funded in a number of countries for a number of years now. So this is very much about playing catch-up and actually about bringing the criteria by which these drugs can be accessed to align to other countries.
So you're saying new to us, but not to the world?
Yeah, precisely. Vidaza, for example, which is one of the drugs that they've announced they're widening access to, has been approved by the FDA in 2004, funded in the UK in 2011, and funded in Australia in 2013. So there's nothing new about that drug.
To be fair to them, I suppose after underinvestment for so long, they have to start somewhere, and we're at the bottom of the cliff.
Yeah, they do. I think what we, however, would have liked to have seen, Ryan, is a real dent being made in their options for investment list or the wish list. Pretty much that list increased since May. It went up to about 77, 78. And now with this new announcement, they're back down to about 73, 74, which is the same number that they had announced back in May. So in order to track progress and to see how well Pharmac are doing, we really need to see their wish list come down.
All right. Kadcyla, which is a drug for breast cancer. As part of this announcement, you can get it for early stage breast cancer, but not advanced stage breast cancer. Is that right?
Only if you've received it under the new criteria for the first time when you've been early diagnosed. So if you're early diagnosed with the breast cancer that Kadcyla treats, you can access it. But if you're unfortunate enough to be diagnosed later in life with advanced breast cancer, you can no longer access it. And that's why the Breast SIG, or Special Interest Group, which is a bunch of oncologists that specialise in breast cancer, opposed what it is that Pharmac have done.
Okay. Malcolm Mulholland, thank you very much for your time this morning. We really appreciate it. It's just gone now 22 minutes after 7 o'clock. That's Advocate and Chair of Patient Voice Aotearoa, Malcolm Mulholland. Let's go now to Pharmac to respond. Pharmac's Director of Operations, Lisa Williams. Lisa, good morning. Just on Kadcyla, why didn't you go for the advanced stage breast cancer patients with that?
Yeah, thanks, Ryan. So the advice that we'd had from our clinical experts was that the evidence for the use of that medicine in later stage breast cancer just wasn't as developed. But I just want to point out that there are other treatments that are funded, Herceptin for use in later stage breast cancer. So that's still available for people who are diagnosed at a later stage in their illness.
And is that better than or equal to the Kadcyla?
What the expert advice that Pharmac received was that the evidence around use of Kadcyla in late-stage breast cancer was not of good quality, so the evidence around Herceptin is better.
Okay, and do they use Kadcyla in any other jurisdictions you're aware of for late stage?
I'm not aware of that.
Okay, let's talk about the list. Malcolm Mulholland says that they're not new. They're new to us, but not new to the world. Do you accept that criticism?
Yeah, we published our options for investment list, which Malcolm talked about 12 months ago, because we wanted to be more transparent about the list of things that we want to fund. And we're really excited about getting this new money. We've got $71 million available to spend this year and another $120 million next year. So we think we're going to be able to make a really good dent in that list. And these medicines that we've announced funding for today, they're just the start.
Okay, so we're kind of playing, as you say, playing catch-up with the rest of the world. When do you think we will get to a point, or will we get to a point, where our drugs, particularly for cancer, are just as good as Australia's?
Well, look, Pharmac receives around 80 funding applications for new medicines or expanded access to existing medicines every year. So we're always going to have a list of medicines that are going through the process, being added to that options for investment list, and that we're using our fixed budget to try and fund for New Zealand. That's our job, to try and get the best we can out of the money that we're allocated, and you know, make those kind of choices. I know you were talking about that earlier when talking about making choices for families investing in insurance. That's what we do at Pharmac. We've got our fixed amount of money, and we've got to choose which medicines to buy off that list.
Okay, and so how many on the list at the moment?
There's about 73 different medicines for about 120 different indications.
Okay, so 73 at the moment. And is it fair to say that until you get more money, we'll probably hover around that figure?
Oh, look, with the new money, which is like, it's the biggest budget increase we've had for over 14 years, we are going to make a really good dent in that list. And that's our job. That's what we want to try to do.
What's the target? What, Lisa, what's the target?
We want to secure...
What's the goal?
Our target is to get as many of those medicines as possible. So, you know, our team's going to be going out now and trying to get the best deals we can with New Zealanders' money to ensure that we can buy as many of those things as we can.
You must have some idea, Lisa, with the money that you have been allocated, that you've got to spend, how many of them you might be able to tick off? 20, 30?
Yeah, well, one of the things that we're doing in the next couple of weeks is we're going to issue a competitive process where we're asking suppliers to give their best prices for lung cancer treatments, and that's with something that we've been hearing from the community for a really long time, that they want treatments for lung cancer. And so until we can understand how much that is going to cost to invest in, we'll know how much we've got left over to spend on other medicines.